Hello, and welcome to the Business Council of Westchester Member Spotlight. I am Linda Tyler and your host today. The BCW is the county's largest and most influential business membership organization, offering over 100 events, programs, and panel discussions yearly. I'd like to thank our sponsor today, Tompkins Community Bank. Tompkins Community Bank is proud to support the Business Council of Westchester. For generations, Tompkins has helped the communities we serve thrive and grow. As a community-based financial institution, we consider it our duty to provide innovative financial solutions for local families and businesses as they navigate their financial journeys. At Tompkins, you don't have to choose between business as usual. Instead, choose business accomplished and business accelerated with cash management solutions that help you manage your growing business. Tompkins, your bank of choice. Today, I'd like to introduce two highly regarded physicians. These men have created impressive and cutting-edge medical practices. We're going to learn more about their specialties and their medical and entrepreneurial journeys. Our guests today are Dr. Tarek Corbin. He is an MD, DMD, board-certified oral and maxillofacial surgeon, as well as the co-founder of Facial and Oral Surgery Specialists, along with Dr. Matt Clark. They are located in West Harrison, New York. With us also today is Dr. Nitin Gupta, board-certified pediatrician and founder of the Concierge Medical Practice, Rivertowns Pediatrics, located in Dobbs Ferry, New York. Thank you both for sharing your expertise with our listeners today. Let's start by telling me about your areas of expertise and your medical practices. What makes your practices so unique? Dr. Gupta, why don't we start with you?
Well, I think, so my area of expertise is pediatrics. So that's, those are ages from 0 to, we do 25 years of age. Okay. And I think what makes us unique is the level of access our patients have. That's probably the biggest pain point that a lot of parents are feeling. Kid gets sick at 8 p.m., they need to talk to their doctor. And so we're just a text away. They can call us directly. It's 24/7 access to the pediatrician. Our patients don't have to go to an urgent care. And there's nothing easier than just texting the doctor. The majority of our patient encounters are actually via text. And sometimes we'll get a picture like, hey, is this a pink eye? No, that one's okay. And we can kind of direct them right then and there. That way it saves the parents time, kids can go off to school, and everybody's happy.
And also, I think parents, I remember being a new parent when you have a newborn, and to have that kind of access for questions is critical, and really all the way through. That it's a wonderful, wonderful service. I know concierge medicine is growing. Dr. Corbin, let's tell us a little bit about your area of expertise as well.
Well, thank you for having us. First and foremost, thank you, Linda. Dr. Gupta, pleasure to be here with you. So we built, my partner and I, a surgical facility. It's almost like a small hospital. It is purely outpatient. It is a private office, but we wanted it to be an office that could really do almost anything we can do on an outpatient basis. So we kind of looked at the landscape when we were first trying to go into private practice, and there was really nothing like that out there. So we just decided to kind of put our efforts together and to achieve it and build it ourselves. We want to do procedures from the most routine types of procedures in oral and maxillofacial surgery to a little bit more complex procedures like orthognathic surgery, full arch implant surgeries, cosmetic facial surgery. And traditionally, patients had to be taken to the hospital here in this part of the county. But there are established protocols and systems that we know work in order to have a nice or ambulatory surgery center like ours. And we knew people that had accomplished it successfully, and we just decided to do it in our own way here. And we also have a very boutique feel, almost like a spa-like atmosphere, which we feel puts patients at ease, and we're able to kind of do really a broad spectrum of procedures and non-surgical treatments for our patients. So.
You're really both of your practices are filling a need within the community that's being well served. Let's talk a little bit too about what made you, the two of you, decide to start your own businesses, and what has your entrepreneurial journey been like? Because it's very different, right, to be a business person as well as a medical professional. So let's talk about that.
Yeah. Okay. So for me, I graduated from residency and actually left fellowship in 2011. And if you were to look at my resume, it'd probably be the worst resume, bouncing from job to job every 9 to 24 months. And the last job I was at actually was a great job. The problem was that was the point where I realized it wasn't me; it was the system. I was a popular pediatrician at a practice that was owned by a hospital system, and I was seeing 40 patients a day. You can't provide quality care if you're seeing 40 patients a day. And I realized this was not quality care for a patient.
Wow, that's like 1 every 10 minutes, right? So
that's every 10 minutes, but that's not 10 minutes of face-to-face time with the doctor, right? I would probably be in there for 3 to 5 minutes because the nurses would kind of run the strep tests and maybe get the vitals, and then I would just rush in, kind of, okay, look in the ear. Cool. How many days has it been? Okay, 3 days. All right, cool. And then move on to the next room and try to, as I'm moving to the next room, get that prescription order in at that time. And then pretty much at the end of the day, I was burnt out. So of course, like the day ended at 5, or if my shift ended at 6, a patient, sure enough, would call like 5:15 or 6:15. For me, I'm like, nope, sorry, go to the urgent care.
Right.
And that I realized, and then actually in 2017, and this is where things changed, that was when we started to see the rise of the high deductible plans. And we had a terrible flu season. And then at the same time, they defunded the Children's Health Insurance Program. So a bunch of my Medicaid insurance patients lost their insurance overnight. And so you had patients who had high deductibles who couldn't afford to see me for those 5 minutes. They would get a $500 bill. And then you had patients who were no longer insured.
So you really, and your service, I remember you when we talked earlier, you have really a reasonable monthly fee
Absolutely.
for your patients.
It was at that moment where I realized, why
That
do we
was your
charge
light
so
bulb
much?
moment,
That was my
right.
light bulb moment.
Wow.
People need access. People need it affordable.
And you're giving it all.
And I'm giving it all.
I-
So when we hear the word concierge, that really was kind of put on me.
That's the term now, right?
That's the term. That's what people understand as, oh, they don't take insurance. But I really wanted to make it something that my community can access.
And we're going to talk more about that in a minute. Talk about, what was your decision? What made you decide that you and Dr. Clark wanted to go out together and really create your own practice as well?
I feel like that's a very inspiring story, Dr. Gupta, that you just said. I wish we had such an inspiring story. I think we wanted to do a practice that we wanted to fit our vision of what we wanted to accomplish for our patients. And so we just didn't see it out there. It just wasn't there. So we're probably like the only office like this in this geographic area. Otherwise, we might have joined another practice. We were both in a hybrid of hospital, private practice, heavy insurance practices, more fee-for-service practices. So we were kind of like in the broad like spectrum of any type of practices, even some corporately owned practices. And we then decided to combine all that cumulative experience into one surgical center and office where we could really treat everyone in the same location and also offer like the best type of results that we can offer. And so to achieve this, we went and got surgical accreditations, as well as other like hospital standard type of accreditations that we were able to achieve that weren't there like in this area.
And what I'm hearing, which is great for all entrepreneurs, regardless of industry, is that on your journey, you get to take back control, right?
Yes.
You get to decide what is important to you, how you want to go back and do it, and what you're trying to achieve. Let's talk a little bit about healthcare trends in 2025. What are you two seeing? What should people who are listening, whether it's for their children or themselves, what's happening in health right now? What are the trends?
Health, and then healthcare and health industry. There's three. Health. Oh, geez. I mean, well, we do have a rising measles epidemic throughout the country.
Yes.
Rising whooping cough rates, and then potential cuts, which will limit the access to our children to those vaccines. that could prevent these illnesses. So that's something that kind of keeps me up at night. In terms of the healthcare industry, I think for 2025 we are going to see increased costs. Premiums have already gone up. Medicare reimbursements have gone down, are going down 3%. I think just last week, the value of United Healthcare they lost about 50% of their value.
Oh, wow.
That's going to translate into increased costs to the patient and to the hospitals. And so, sorry I seem so bleak about this, but
well, we'll flip the coin a little bit, right, and talk about some of the things that are going well, right? People longevity, people are taking care of themselves better. Would you say more aware? Want to talk about what you're seeing there too? We'll look at both sides of the coin.
Yeah, I mean, I think there's some disruption coming. So I think in the healthcare, the way healthcare is consumed in this society now, not just because of AI, which I think is a topic we might delve into later, but just what people are expectations are in healthcare is becoming more like a consumer relationship. So people want healthcare to be different than it was before, and I think that's one thing where the insurance model might feel a little bit out of place. The way it is. It was encouraging, or somehow just the way the system was set up, it was forcing physicians such as Dr. Gupta in the past to see 40 patients, and that burnout feel that physicians were having, patients were feeling it too, because they were also on their end experiencing the same types of issues.
And they're being treated as a number.
They were treated as a number.
And you too, through your practices, I'm sorry, I didn't mean to jump in, but you can control that patient flow much better, and that made that experience, and that talks. I want to touch a little bit more about trust too.
Yeah.
You know, with building that patient trust, and that also dovetails into word of mouth and how that's so powerful. Let's address that patient trust and building that word of mouth in terms of practice and as you grow your businesses.
Yeah, well, I think the number, what you just said, Dr. Gupta, is 100% accurate. I think a lot of the patients that come to us oftentimes are fed up with the corporate healthcare infrastructure, and the practices with whom we partner with, which is because we're very referral based ourselves. So a lot of them are kind of similarly benefiting in a way from the exodus of patients from the corporate or insurance heavy models, going towards more individualized or patient-centric practices, and then patients then gravitate towards that model. Now, it doesn't mean there isn't room for a hybrid model where insurances are also part of this, but I think the traditional insurance model is not phasing out, but changing. And a lot of patients in some demographics don't want to be in that system anymore.
Yeah. I guess, that's, I think for us also trust, they are parents are scared. Or parents they have a question. They need to talk to a doctor. And so we have time for it. And so they come to us because our visits are at least 30 minutes.
Yeah.
And sure, I could see the kid in 5 minutes. Often I am done in 5 minutes. But I'm actually spending time with the kid. Our physicals are an hour at minimum, and they come into it's not really a waiting room, it's a playroom. When the kids come in, they go straight to the toys. That's actually my developmental exam, actually watching them play with the different sensory things and seeing their pincher grasps, how they're picking up things, if they're playing and pretending that they're feeding the baby with a bottle. And that's all part of my exam. That time gives that time that we're spending gives the parents that sense of trust. Also, the kids are not coming into a screaming waiting room. So those little kids have the trust with us. And I just realized, I was looking at a video that a parent took, and she sent me, of this kid, he's a toddler, of how we were kind of wrestling around. And I realized, wait, in my old practice, no toddler would ever come and kind of wrestle with me. or play toys with me, they actually were trying to run out screaming.
And that's building the rapport. And when
Yeah.
you see a patient, I'm just thinking about this, and you see them as an infant or a toddler, and you're going to see them regularly for the next 20 years, that's building that trust and
Yeah.
rapport so that as they get older and they're teenagers, and sometimes those conversations are harder and just as important, they've got that relationship built, which
Yeah.
is so important.
They're not a number.
They're not a number. And let's talk a little bit, because marketing is a part of every business, and especially important for entrepreneurs, whether you're in, healthcare or IT security, or you're a law firm, whatever it is, marketing matters. Tell us a little bit about what you have found to be effective marketing for getting the word out about your wonderful practices. What do you find to be, some really important ways to do that?
For us, I think marketing is very complex. So I think there are so many ways to succeed. Like my wife is also a physician, her own practice, and we were speaking about that earlier. Like there's different strategies for everyone, but personally, for us, we focus on the quality of the care. So for us, it was just make sure every single patient that walks in here gets the best possible experience, and we just focus on making sure that we do everything we can that is within our control to focus on their experience. So we really want them to alleviate anxiety. We focus on the post-operative care and the follow-ups, the phone calls. So we offer this almost like white glove experience, and we were purely focused on that for the first few years. And now we still want this for our patients, but now we're kind of delving into more complex marketing strategies, whether in-person referrals, networking, study clubs, and then also the online advertising, the social media. All that is they're all part of the strategies for us, but the patient experience was for us the most important part. And we feel for us it worked because we're offering our service is really the surgery and the experience itself. So we focus on the product that we offer. Yeah.
Well, that's what it is. The product is what sells, right? I tell my associates and everybody that the patient is your biggest billboard.
Absolutely.
And so, but for me to even get there, when I first started the practice, I was not known. I was working in Rockland County before I opened up my practice in Dobbs Ferry. And so what I did was I hired a marketing company locally, and we really focused on social media. And the biggest return on investment was social media. Where are parents asking questions on the parent groups? People are asking, can anybody recommend a pediatrician? Can anybody recommend a specialist? Or my kid has a fever. Where should I take my kid? So I really kind of tapped into that. My marketing team would kind of toss in our website and say, hey, Rivertown's Pediatrics, brand new. But it really still is going to be word of mouth, especially from our patients, because they are the biggest billboard, but also the networking and just really what I call pounding the pavement. I still continue 7 years later, and we've expanded, and still continue to kind of go walking down the street, Main Street, just say, hey, can I leave some brochures? Because for me, it's a little bit of a challenge because, there's a pediatric office in every corner in Westchester. So
No, you're right. That awareness, that trust, networking is huge. So you're all doing all of the right things. And even I love, because reducing anxiety, I don't care what kind of surgery you're having, major or small, there's a little bit of anxiety. And the same thing as a parent, you take your child in, especially when they're really little. So you're both really working on reducing that anxiety and building the trust. Aside from great medical care, what do you think is most important for patients today? What do you think is top of mind for them?
I think communication. I think that's one thing where oftentimes it is difficult to get access to a doctor, like Dr. Gupta's practice and in our practice as well. We text directly with our patients as well. We have our entire team answers the phone, so there's no prompts. Very rarely do we put patients on hold. So we try to just focus on communication, because that is also, we feel lacking elsewhere. So it does differentiate our practice from other practices. Yeah.
100%. I agree. We do not believe in a phone tree. There's no phone tree. It's there's somebody there to answer our office phone, and that's it. And then our patients just text us or call us directly, the doctors. And it's it sounds so basic, but that's the low-hanging fruit for us.
It's huge.
Communication is so difficult with
Yeah.
other practices. With us, that's our selling point.
And that ties into reducing anxiety and building trust. So,
Exactly.
very, very good points. And as entrepreneurs, successful entrepreneurs, what advice would you give to someone who's thinking about, maybe launching their own business? And a little words of wisdom. What would you do again? What would you do differently? Love to hear from you both on that.
I would just say it is something where it's not for everyone, but if you want to own your practice, so speaking from a medical professional or any type of businesses, but if you want to then not focus only on your craft, but also management, which is an entirely different beast. You have to be okay learning new skills. So you cannot just come into this new sphere and expect everything to be okay, because you have to be comfortable with marketing, management, human resources. Every single hat you have to be comfortable knowing some
Good
of
point.
it. You might then become bigger and want to hire more professionals and experts and consultants or specialists in their field, but you still will have to be involved in these fields versus just focusing on what you do, and that's totally fine. I have a lot of great friends and amazing surgeons that I know and physicians that prefer not to deal with these things, and they prefer to focus on what they do, which is delivering the healthcare. But if someone wants to be an entrepreneur in our field, then you take it on to yourself to take on this journey of learning and continuing education and learn these skills. Otherwise, it will be harder to be successful. You might still be successful, but I think it will be difficult.
A great point and great advice.
Yeah,
What do you think, Dr.
I'm
Gupta?
glad we are actually doing this together.
Yeah,
'cause,
likewise.
Like I actually want to go visit.
Yeah, we will. I'm sure we will.
But yeah, it's I think if you want to be an entrepreneur, you got to be comfortable with being uncomfortable.
Yes.
Because if you want to open up your own practice, thinking that your life's going to be easier, no, stay home. It brings on different challenges. And challenges that you don't know. For me, nobody ever would have predicted the pandemic would happen.
Wow.
Right? And there was times where I was getting ready. I was doing drive-up flu shot clinics outdoors in our parking lot, and we had a needle shortage. I was up till like 3 a.m. securing needles from China.
Right.
If you don't have that drive, stay home.
Yeah.
And then when we started getting COVID, being able to start doing COVID testing, we had 13 PCR machines. That was another challenge where then we started to have a shortage of the testing reagents. So again, that was like midnight phone calls around the country trying to secure those reagents, and then it was being ready to pivot when you need to.
Good word, and really rising to challenges, right? Creative thinking outside of the box.
But that was something that those were hard days, but I look back and I think, thank God I was able to do that. Thank God I had my own practice, because if I was a corporate cog, I would have been miserable, because I knew, we had the ability and the capacity to do this, but we wouldn't have been able to do that because we'd have to kind of do it as a corporation.
Thank you both. These are wonderful stories, and they're stories of resilience and success, and just to see and hear about your journey has been wonderful. Thank you so much for sharing your time and your expertise and your stories with us. And we look forward to sharing this information with our listeners.
Thank you for having us. It was great.
Thank you.
Be sure to check out the BCW Podcast Network's expansive lineup of shows: Leadership Unleashed, What's Trending, Advocacy and Politics Unplugged, The Member Spotlight, and Nonprofit Voices of Impact. The Business Council of Westchester is the county's largest business membership organization focusing on economic development and advocacy. With over 1,100 members, it is our mission to work for the profitability of our members and the prosperity of the Westchester community. To learn more, go to thebcw.org.